what's up? Let's finally talk about the female genital system. Now, this is going to be a longer video than usual. It's not because the female genital system is necessarily difficult, but it's because I want to cover everything in detail so that you understand the fundamentals of the female genital system. I've put some timestamps on the bottom of the video, so you can use that if there's any specific topic you came here for. Alright, so the female genital system is generally divided into the internal genital organs and the external genital organs. We're going to cover the general external and internal structures of these parts and go through their coverings. And we will start with the internal genital organs. The internal genital organs consist of the ovaries, the uterine tube, uterus, and the vagina. Now let's go detailed into each of these parts, starting with the ovaries. So we will first go through its inner structures and the growth and maturation of the follicle. Then we will cover the external anatomy of the ovaries along with how the ovaries are fixated. Now, the ovaries contain oocytes within follicles, right? And they produce steroid hormones, which are estrogen and progesterone. So if we take one ovary and slice it right about here, then remove the upper half, this is what the inner surface of the ovary generally look like. Here we've included all the faces of the follicles. First off, the surface of the ovary is covered by the tunica albuginea, composed of connective tissue fibers. Within the actual ovary, between the follicles, you will find loose connective tissue, right? That connective tissue is called the ovarian stroma. The ovarian stroma forms the ovarian cortex and the ovarian medulla. The ovarian cortex is the outer region where the follicles rest and develop and mature. So this is the primary site of the ovaries. The ovarian medulla is the middle part of the ovary, and it contains loose connective tissue with many blood vessels and lymph vessels and nerve fibers. Now, just to give you a slight sense of what it looks like, here at the outer layer, that's where you'll find the tunica albuginea, which supports the outer epithelium. Here is the ovarian cortex with all the follicles, as you see here. And in the middle here, we've got the ovarian medulla, which houses all the large blood vessels and nerve and lymph vessels. Alright. Now, as we said earlier, within the cortex of the ovary, you will find follicles. I'll just quickly take you through the basics of the ovarian follicles. Now, what happens is, when the female is actually born, she will have all the primordial follicles that she'll ever need, which contains primary oocytes. These are dormant follicles with a single layer of flattened granulosa cells. So a female is born with many small follicles that kind of cluster together in the periphery of the ovary. They're called primordial follicles. So they contain a primary oocyte with a single layer of follicular cells. They are simple squamous epithelium. Once the female actually enters puberty, follicular stimulating hormone, or FSH, will stimulate a small number of these primordial follicles to mature. So FSH is going to cause some of these primordial follicles to wake up and become primary follicles. It still contains the primary oocyte, but the squamous epithelium is now cuboidal epithelium. So the follicular cells are now cuboidal cells, so the follicle is growing. Now, these follicular cells will keep dividing by mitosis and form granulosa cells. And once we have multiple layers of granulosa cells that surround the primary oocytes, these are called secondary follicles. In a secondary follicle, the primary oocyte will start to deposit a layer of sugar and protein on the outer layer of the oocyte, known as zona pellucida. And then the granulosa cells that are growing in number also have a few jobs. One thing that they do is that they produce and secrete a follicular fluid which starts to accumulate within the follicle. Granulosa cells also produce estrogen. And so as the follicle is growing bigger in the ovary, estrogen levels are also going up. So this is what a late secondary follicle looks like. Follicular fluid is building up, and notice the several layers of granulosa cells. This is still a primary oocyte because remember, secondary oocyte doesn't occur until just before ovulation. We can also see the zona pellucida surrounding the oocyte, the theca folliculi that are also starting to develop at this point. And remember, they have two layers, theca interna with lots of blood supply and theca externa, which are connective tissue encasement of the follicle. Eventually, as the follicle grows bigger, it becomes a Graafian follicle or tertiary follicle with a large antrum as well as all the other parts that we talked about. Now, the tertiary follicle will start to bulge out. Literally, it will start to bulge out from the surface of the ovary. And just prior to ovulation, that's when the secondary oocyte occur and ovulation happen. After ovulation occurs, the empty follicle repairs itself and it actually thrives and becomes a structure called corpus luteum, which secretes primarily progesterone. And so at this point, after ovulation, progesterone level starts to go up. The corpus luteum has a limited lifespan, and eventually it will start to die off and become corpus albicans. So that was a brief look into the ovary's inner structures. I won't go into a lot more details than that since we're primarily doing anatomy right now in this video. Let's now go ahead and look at the external structures of the ovary. Alright, so here's an external view of an ovary. An ovary has surfaces and margins, right? It has a mesovarian border, which is the anterior margin facing the peritoneal fold of the ovary. Then on the other side, it has a free border or a posterior border, which is free because it doesn't really face any structures of significance. It has the tubal extremity, which is the upper pole facing the abdominal opening of the uterine tube. It has a uterine extremity, which is directed downwards and attached to the lateral angle of the uterus by the ovarian ligament. Then we have two surfaces, a lateral surface and a medial surface. Awesome. So that's the external surface of the ovary. Let's now go through the fixation of the ovary. The ovary is attached to the uterus through a ligament called the ligament of the ovary. This one is pretty straightforward. The ligament of the ovary fixates the uterus to the ovary. A little fun fact about this ligament is that it contains the ovarian branch of the uterine artery and vein, and it contains also ovarian nerves and lymph vessels as well. Then we have the sustentacular ligament of the ovary. This ligament attaches the tubal extremity of the ovary to the lateral pelvic wall, so it helps to fixate the ovary in place. It also contains vessels and nerves as well going to the ovary. Then we have a fold, a peritoneal fold, called mesovarium. Let's repeat something really quick. The peritoneum consists of two layers, right? One that is continuous with the abdominal and the pelvic wall, called the parietal peritoneum, and one that lines the visceral organs within the abdominal cavity, called the visceral peritoneum. Now, here we see the superior view of the uterus and the pelvis, and here we see some ligaments around the inner genital organs. One ligament that is crucial to know about is called the broad ligament of the uterus. This ligament is actually a double peritoneal fold. So the peritoneum goes down to the uterus and folds double and forms the broad ligament of the uterus. So the broad ligament is attached to the uterine border medially and is laterally continuous with the parietal peritoneum of the pelvic wall. The broad ligament of the uterus consists of three parts. But there is one particular part of this ligament that is important to know regarding the fixation of the ovary, and that one is the mesovarium. So the mesovarium is a component of the broad ligament, it's the smallest component of the broad ligament. And the good thing with the mesovarium is that it suspends the ovaries, it fixates them to the actual uterine wall. So that was all for the fixation. I hope the mesovarium made a little sense. I will touch back upon the broad ligament again soon as we go through these organs. Alright, so that was everything I had for the ovaries, as far as the anatomy goes and a little extra. Let's do the uterine tubes now. The uterine tubes, or the fallopian tubes, are paired tubes that go from the uterus to the ovaries. So it has two openings. One side opens into the peritoneal cavity but faces the ovary, and one part opens into the uterus. So they're the arms of the uterus, you can say. What it does is that when ovulation happens, the uterine tubes captures the released oocytes and transports them along the tube by peristaltic contractions to the uterine cavity. One thing that's good to know also is that fertilization of the oocyte by spermatozoon usually happens within the uterine tube before it's pushed further into the uterine cavity and gets attached to the wall there. So yeah, let's now do the anatomy. The uterine tube consists of several parts. First, it has an infundibulum, which is the dilated part adjacent to the abdominal opening. It has an ampulla, which is the wider lateral 2/3 of the uterine tube. It has an isthmus, which is the narrow medial 1/3 of the uterine tube. And it has a uterine part, which is usually the intramural segment of the uterine tube, located within the wall of the uterus. So let's go ahead and go a little deeper into the anatomy of the uterine tube now. On the infundibular part, you will find an opening, right? That opening is called the abdominal ostium, which is an opening that faces the ovary. So it directly opens into the peritoneal cavity and it catches the oocyte once ovulation happens. Now, how does it do that? It does that through the help of something called fimbriae. These are mucosal arms or tentacles or whatever you want to use to describe them. But of all the fimbriae, one fimbria is actually long enough to reach the ovary, and this one is called the ovarian fimbria. An ovary is not directly connected to its adjacent fallopian tube, right? And now you might wonder, doesn't that leave a chance for the oocyte to not go into ovarian tube? Well, yes, there's always a small chance, But this is actually a very controlled process. I couldn't animate it, but I'll try to explain. When ovulation is about to occur, the sex hormones activate the fimbria, causing them to swell with blood and hit the ovary in a gentle, sweeping motion. An oocyte is then released from the ovary into the peritoneal cavity, and the cilia of the fimbria sweeps the ovum into the fallopian tube. It's a cool process. And here's a little better representation of the ovarian fimbria. You see it goes along and reaches the ovary, compared to the other fimbria of the uterine tube. The other opening, which opens into the uterine tube, is called the uterine ostium, as you see here. Now I want to take a small segment of the fallopian tube and look at the walls to understand how the uterine tube is actually built. The uterine tube is simple. It consists of a mucosa, muscularis, and a serosa. The serous coat covers the tube intraperitoneally except for an area where the mesosalpinx is, which is another part of the broad ligament of the uterus. So remember we talked about the broad ligament and how it fixates the inner organs and how it consists of 3 parts. One part fixates the ovary, called the mesovarium, and another part now is called the mesosalpinx, this one. It fixates the ovarian tube, and along this place, arteries and nerves enter the tube, but veins and lymphatics leave it. Awesome. I will stop here. That's all you need to know about the fallopian tube's anatomy. Now, let's do the uterus. Now the uterus is such a cool organ. It undergoes cyclic transformation, it's synchronized with the ovarian cycle to ensure that the uterus is ready for implantation of the fertilized ovum. And, at one point we've all been inside of one of these. So let's go through its anatomy. Let's first change the angle. First off, you need to know that it's normally positioned in anteflexion, meaning that it's bending forward, and that it's almost completely covered by the peritoneum. To cover as much of the uterus as possible, I want to remove half of it to get a better view. And let's also look at the uterus from this perspective. We will see this. Alright. The uterus consists of a fundus, which is located above the entrance of the uterine tubes. It has a uterine body, which is the thickest part of the uterus. The uterine body has 2 surfaces, and if you look here, one surface is called the visceral surface, or the anterior surface, because it faces the urinary bladder, and one surface is called the intestinal, or posterior surface, because it faces the sigmoid colon. What separates these 2 surfaces is the border of the uterus. This border is where the broad ligament of the uterus is attached to. Another part of the uterus is called the cervix of the uterus. This is the cylindrical part of the uterus. The lower part of it lies in the vagina, and the upper part of it is above the vagina. That means that we can subdivide it into the supravaginal part and the vaginal part. Other things we can see here are the uterine horns, which are paired structures through which the uterine tubes enter the uterus. It's pretty straightforward, isn't it? Now, inside the uterus, we can see the uterine cavity, right? This cavity has 3 openings. two at the base where the uterine tube opens, called the uterine opening of the oviduct, and one opening down here at the end of the cervical canal, called the external os of the uterus, which is the opening of the cervical canal of the vagina. This canal is bordered by the cervical lips. So if you look at the posterior lateral angle of the uterus and the vagina and remove the posterior wall of the vagina, we will be able to see the external os of the uterus. And we will also be able to see that it's bordered by the anterior lip of the cervix and the posterior lip of the cervix. In nulliparous women, meaning women that haven't had a baby before, this orifice is small and round, as you see here on the left, and after childbirth, it becomes like a narrow fissure, as you see here. Let's now take the uterus, take one piece of it out, and look at it underneath the microscope. We will see this. Now the uterus consists of an endometrium, a myometrium, and a perimetrium. The endometrium contains specialized mucosa that undergo marked changes during the menstrual cycle. It consists of two layers, a functional layer that undergoes menstrual changes, and a basal layer that doesn't really change during the menstrual cycle. Now the functional layer is special. Let's zoom in on it. It consists of simple columnar epithelium. It has an endometrial stroma, which is the underlying connective tissue, and it has many uterine glands, which during the menstrual cycle, the surface epithelium invaginates into the stroma to form simple tubular glands, which is the one you see here. So what happens is, while the follicle is growing, it releases estrogen, right? As the estrogen levels gradually rise, it signals to start the proliferation phase of the menstrual cycle. At this point, the blood discharge starts slowing down and then stops in response to the rising hormone levels. The lining of the uterus will thicken and proliferate with the rising of estrogen. Then, when ovulation happened due to the spike in luteinizing hormone release, after ovulation, under the influence of progesterone, the endometrium changes to a secretory lining in preparation for the potential implantation of the embryo to establish a pregnancy. If implantation happens, the inner lining remains. But if implantation doesn't happen within approximately 2 weeks, the progesterone-producing corpus luteum in the ovary will die off, right? And since corpus luteum is the one that produces mainly progesterone, if it degenerates, the progesterone and the estrogen levels decrease. This hormone decrease causes the uterus to shed its lining during menstruation. So, with this in mind, this specimen is from an early secretory phase of the menstrual cycle because the uterine glands are mostly straight and only slightly dilated. So that was the functional layer of the uterus. The basal layer, again, is retained during menstruation and regenerates the functional layer. Next, let's do the myometrium. The myometrium is composed of 3 layers of smooth muscle. The inner and outer layers are mostly longitudinal bundles of smooth muscle. And we got the middle layer, which is the thickest layer of mostly circular or spiral bundles of smooth muscles with numerous blood vessels. Now, the uterus contains a unique system of blood vessels that undergo marked changes during menstrual cycles. It contains arcuate arteries, which encircles the uterus in the myometrium. Arcuate arteries branch off as radial arteries that ascend into the endometrium. The radial arteries give off straight arteries, which supply the basal layer, and spiral arteries, which pass through the basal layer and supply the functional layer. Alright, the last layer is the perimetrium, which is the outer serous layer of the uterus, and it's continuous with the broad ligament, as you see here. Now, let's go through the fixation of the uterus. The uterus is held in place by the help of the peritoneal folds, the parametrial ligaments, and the supporting apparatus of the uterus. Remember we talked about the peritoneum and how it consists of 2 layers, and then we talked about how the peritoneum forms a double fold at the uterus, forming the broad ligament of the uterus, which is attached to the uterine border medially, and is continuous with the parietal peritoneum of the pelvic wall laterally. The broad ligament consists of three parts: the mesovarium, which is a peritoneal fold of the ovary, the mesosalpinx, which is a peritoneal fold of the uterine tube, and the mesometrium, which is a peritoneal fold of the uterus. They are all a part of the broad ligament of the uterus, and they help fixate the organ in place. And here's another angle, kind of showing you that the broad ligament is more vertically located along the uterine border. Alright. Parametrial ligaments are ligaments that hold the uterus in its proper position in the pelvis. These are the cardinal ligament of the uterus, which extends from the cervix uteri to the lateral wall of the pelvic cavity. There's the vesico-uterine ligament, which extends from the uterus to the urinary bladder. The pubo-cervical ligament goes from the pubic symphysis to the cervix. Then there's a uterosacral ligament and a recto-uterine ligament. So that's these. Another para-umbilical ligament that's very important is the round ligament of the uterus, which keeps the uterus in anteversion, especially during pregnancy. Next, we have the supporting apparatus of the uterus. This mainly includes the perineal muscles, and these muscles hold the uterus like a plate. So here we see the posterior aspect of the pelvis. If we go ahead and expose it a little bit, we'll be able to see the perineal muscles here. They provide support to the inner genital organs. Another supporting apparatus is the levator ani muscle. So if we add the pelvic bone back, and there you see the levator ani muscle, it also supports the uterus. So that was the fixation of the uterus. Alright, 3 down. Let's quickly do the vagina, and then we will do the external organs. The vagina is a hollow muscular tube that serves as the terminal part of the female genital tract. It extends from the uterus to the external genitals and ends with the vaginal orifice, located within the vestibule of the vagina. Vestibule is just the space bordered by the inner lips. Within the vagina, you will find the vaginal canal, which is the cavity of the vagina. This cavity is bordered anteriorly by the anterior wall and a posterior wall. Up in this area, around the cervix of the uterus, you will find a groove. This groove has an anatomical name called the vaginal fornix, and it has an anterior part, which is the shallow part of the fornix, and it has a posterior part, which is deeper, and 2 lateral parts. At the external vaginal orifice in young women, you will find a thin piece of mucosal tissue that surrounds and partially covers it. From the 3rd week of gestation to the 2nd trimester, the hymen is formed following the vagina. Some girls are born without a hymen, others only have a fragment of tissue. It doesn't grow back, which is fine because it really doesn't have any practical use anyway. But as you see here, the hymen can have several anatomical variations. It can range from thin and stretchy to thick and somewhat rigid. 1 or 2 out of 1,000 infants may have an imperforated hymen though. This is the only variation that may require medical intervention because it can completely prevent the passage of menstrual fluid or slow it significantly. And in a practical setting, the hymen can stretch or tear as a result of various behaviors by the use of tampons or menstrual cups or pelvic examination with a speculum and sexual intercourse. Alright, let's change the angle. In front of the vagina, you will find the urinary bladder and the urethra. So between them, you will find the urethrovaginal septum, which is just a plate of connective tissue. And behind the vagina, you will find the rectum. So in between them is the rectovaginal septum. And as the peritoneum covers the inner walls of the pelvis, it forms a pouch called the recto-uterine pouch, or sometimes also referred to as the pouch of Douglas. Alright, let's now take a piece of the vaginal wall and look at it underneath microscope. We will see this. So it's going to have a mucosa, a muscularis, and a serosa or adventitia. The mucosa of the vagina it forms numerous transverse folds on the surface of the mucosa. And if we take a closer look into the epithelium of it, you will see that it's lined by stratified squamous non-keratinized epithelium. Under physiological conditions, estrogen promotes the storage of glycogen in the middle and the upper layers of the epithelium. Now, why would you need these cells to store glycogen? As the epithelial cells are exfoliated, glycogen is released, right? This released glycogen will get metabolized by bacteria producing lactic acid. This lowers the pH in the lumen and inhibits the growth of certain pathogens. Pretty cool process, right? That's why sometimes issues with estrogen levels can be reflected by the vaginal discharge. So that's the mucosa. The muscularis is composed of two indistinct layers of smooth muscles, an inner circular layer and a much thicker outer longitudinal layer. Then the outer part is either adventitia or serosa. The adventitia consists of loose connective tissue and provides a connection with the surrounding organs, which is the rectum, the urinary bladder, and the urethra. Tunica serosa covers the upper part of the posterior wall of the vagina. Awesome. So now we've gone through the ovaries, we've gone through the uterine tubes and the uterus and the vagina. All of these are considered the internal genital organs. Let's now go through the external genital organs. They're pretty straightforward. So let's look at this model from this perspective. We'll see this. The external genital organs consist of a vestibule, labia minora, the clitoris, bulb of the vestibule and its associated glands, and the labia majora, or the outer lips. So let's go ahead and start with the vestibule first. The vaginal vestibule is an area bordered by the labia minora, and within the vaginal vestibule, you will find the external urethral orifice coming from the urinary bladder, and the vaginal orifice, which leads into the vagina. You will also find the lesser vestibular glands, which help secrete a substance to lubricate the urethral opening. This substance is also believed to act as an antimicrobial as well. Now, there are paired mucous glands embedded in the perineal membrane called the greater vestibular glands, or Bartholin's glands. These glands are going to open into the posterior part of the vestibule. They secrete fluid that helps lubricate the vagina, and sometimes the ducts of these glands can become obstructed and fluid backs up, forming a cyst called the Bartholin cyst. So that was the vestibule. Around the vestibule, you will find labia minora. Labia minora are two small cutaneous folds situated between the labia majora. They extend from the clitoris obliquely downwards, and the posterior end of them are usually joined across the midline by a fold of skin called the frenulum of the labia minora. The inner surface of the labia minora is lined by mucus containing numerous glands which moisten the vaginal vestibule. Next, we have the clitoris, this one. The clitoris is one of the most sensitive erogenous zones due to its high concentration of nerve endings. We say it's the female version of the penis since it's made up of corpus cavernosum, the same as the penis. That's the erectile tissue. It consists of glans clitoris, which is the terminal external part, the body of the clitoris, which splits into two crura of the clitoris. Around the glans clitoris, we have the prepuce of clitoris, or the clitoral hood. This is a fold of skin that surrounds and protects the glans clitoris. So that was the clitoris. Then we have something called the bulb of the vestibule. This is a type of erectile tissue closely related to the clitoris. The vestibular bulbs are two bulbs of erectile tissue that starts close to the inferior side of the body of the clitoris, and then it extends towards the urethra and the vagina on the medial side of the clitoral crus. It is formed by a plexus of venous blood vessels covered by a capsule. Alright, let's now do some other external structures. Here we see the labia minora and the glans clitoris. Lateral to the labia minora, we can find the labia majora. Each labium has two surfaces. It has an outer part, which is basically skin covered by hair, and an inner part, which is smooth with sebaceous glands. The labia are thicker upwards, and at the upper angle where they meet, we call this area the anterior commissure. And posteriorly, they don't directly connect as the anterior side does, but together with the surrounding skin, they form the posterior labial commissure. In front of the pubic symphysis, we can find the mons pubis, located above the labia majora. It is triangular in shape, formed by fatty tissue, and becomes covered by hair at the time of puberty. This is also where the round ligament of the uterus attaches to. So that was finally everything I had about the female genital system. We talked about the internal female genital organs, which consist of the ovaries, the uterine tubes, the uterus, and the vagina, and the external genital organs, which consist of the vestibule, labia minora, clitoris, bulb of the vestibule, the labia majora, as well as the upper area called the mons pubis. I really hope you found this video helpful. If you did, please put a like, comment, and subscribe. See you next time.